So AASAS is actually a network of 14 sexual assault serving agencies across our province. And those member agencies provide services. They're responsible for the day-to-day frontline delivery of services within their communities as well as their regions. And while they do work beyond the cities or towns where they're located in, we know there are still lots of areas in Alberta that don't have specialized sexual assault support services yet. We'll say yet. So sexual assault services came together to identify the services that they needed to provide a fulsome response to sexual violence in their communities. Now, the services listed on these slides are what they came up with collectively. So if you have a sexual assault service center in your town or city, you'll have all of these services, but there are communities out there that may only have one or two. But for a fulsome response, we feel that you really should have all of them. So our member agencies provide crisis response, counseling, education and prevention, police and court support, and outreach to underserved populations or people who experience extraordinary barriers to accessing services. So I'm going to go into detail about 3 of these on the slide that are probably the most important to our audience, hopefully. So the crisis support includes stabilization, risk assessment, information, referrals, and accompaniment to the hospital for medical treatment. In terms of police and court support, we know that with adequate intervention support, victims of sexual assault can proceed effectively and efficiently through the criminal justice process and recover from the effects of trauma. So our member agency police and court support services provide the first point of contact support, unbiased presentation of potential legal options, accompaniment for police reporting, liaison and advocacy between the victim and the legal system, which includes police and Crown, building of coping strategies, court preparation and accompaniment, and supportive follow-up both during and following the court proceedings. So these services do lead to a better experience for the victims, and what that does is make them more willing to participate within the system. For counseling, sexual violence counseling focuses on helping survivors of all ages and genders and their non-offending family members cope with the effects of the trauma they have experienced, and both short-term and long-term counseling services are required. To take a close look at our counseling services, from 2013 through 2019, the demand for specialized sexual assault support services has increased. You can see quite dramatically. In 2013, our members had, 1,733 new counseling intakes and 11,030 counseling sessions. And in 2019, our members had 4,321 new counseling intakes and 35,562 counseling sessions. Now, the sessions include existing clients and the new counseling intakes. Typically, 25% of our clients are children and 75% are adults. Some centers start seeing children at the age of 3. And we do know that sexual violence is particularly high risk for adolescents. With the exception of Edmonton and Calgary, the child advocacy centers in Alberta are located with our sexual assault services, and the organizations work hand in hand to help children. It is also important to note that a large portion of the adults that we see were sexually abused as children and did not disclose. Instead, they disclose well into adulthood, and that's when they come to our agencies for support. About 13 to 15% of our clients are male, and 85 to 87% are female. We offer 12 to 24 free counseling sessions, but we do have flexibility. So if someone needs a little bit more, we're not going to say no. And counseling is offered or provided by registered psychologists and masters of social work They're individuals that are registered with a regulatory body and have clinical supervision models. So the in-person counseling that takes place over 12 to 24 sessions is different from the supporting counseling that sexual assault centers provide over text, chat, or phone, or when they're providing systems navigation or police and court support. So this involves short-term, which is anywhere from a half hour to perhaps 1 or 2 sessions, and includes supportive counseling, providing information and referrals, crisis intervention and risk assessment, and teaching skills for regulating and containing emotions and managing triggers. The longer-term in-person counseling is customized to each person's needs and involves setting goals using a feminist framework or power analysis, and includes deeper, more in-depth processing of sexual assault trauma. They use a wide range of therapeutic models depending on the needs of the clients and the skills and style of the therapist. So these might include an eclectic mix of EMDR, or eye movement desensitization and reprocessing, Hakomi, narrative therapy, cognitive behavioral therapy, integrative body psychotherapy, or sensor motor therapy. So if that's what our member agencies do, what do we at AASAS do? Well, we're the unified voice on issues of sexual abuse and sexual assault in Alberta. We have 2 main focuses, which are awareness and access. So we work to increase public and government awareness of issues involving sexual abuse or sexual assault and the impacts they have on Albertans. And we also strive to ensure that all Albertans affected by sexual abuse and sexual assault have access to healing and recovery programs, specialized services, and supports. So earlier this year, we released the results of a prevalence of sexual assault and childhood sexual abuse in Alberta survey. And what that survey showed us is that 45% of adult Albertans have experienced sexual violence in their lifetime. And we know from those numbers that there are so many people out there in our province needing the services that our member agencies provide. And it really does motivate us to continue to make sure that we make our services more accessible in the areas where there really isn't as much out there. And we'll go into that in a couple more slides. So our AASAS initiatives, I'm going to go into detail on the last 6, and I'll just touch on the first 2. So our Counseling Adult Survivors of Sexual Assault training is a 12-week online course. It's designed for counselors who are already providing services that want to include more specialized sexual assault support in their practice. The Enhanced Emergency Sexual Assault Services training is for individuals responding to sexual assaults. So it'll be trauma-informed support, it's medical examination, forensic medical examination information. So they're happening immediately after a sexual assault, this support service. We also provide coordination and collaboration, first responder to sexual assault and abuse training, improving and enhancing the criminal justice response to sexual assault, collaborative community response to sexual assault or rural response to sexual violence, the IBelieve You public awareness campaign, and Alberta's One Line for sexual violence. So coordination and collaboration. So in addition to our senior leadership interagency standing committee, AASAS coordinates a number of interagency advisories and or working groups. And these groups include our member agencies. And that is how we ensure that everything that we do at AASAS is grounded in the needs of survivors. Our working groups include our First Responder to Sexual Assault and Abuse Training Advisory Committee, Clinical Counseling Curriculum Advisory Committee, our AASAS Criminal Network, our AASAS Clinical Network, Prevalent Study Curriculum Advisory, the Specialized Police and Court Support Network, our Developing Communities Network, our One Line Advisory Committee and Operations Committee. We sit on the Federal Gender Equality Network, the Canadian Femicide Observatory for Justice and Accountability, the Ending Violence Association of Canada, and Provincial Family Death Review Committee. So when you look at our organization, our team of 7 employees, we facilitate or participate in approximately 400 external collaboration and coordination meetings each year. So we do like to work together and play well with others to help survivors of sexual violence. Our first responder to sexual assault and abuse training is offered throughout Alberta. We also have it licensed in Saskatchewan. It is a 2-day training inclusive of the full spectrum of sexual violence and across the lifespan. It's directed at professionals and paraprofessionals, and it's really all about the importance of a safe and supportive response to disclosures of sexual violence, because we know if people receive that, they're more likely to reach out for help, not just for counseling, but also medical help, and more likely to report to police. So AASAS participates on the Collaborative Justice Response to Sexual Assault Committee, which is a government-led committee that we were really proud to be invited to join as a community member and work to influence policy and explore ways to improve and enhance the criminal justice response to adult survivors of sexual assault. The committee has identified 6 areas of collaborative action, including increasing access to sexual assault evidence kits in Alberta, and training and education to improve and enhance the criminal justice response to survivors of sexual assault. We also were fortunate to be able to provide input on the Sexual Violence Investigation Best Practice Guide, which was announced and disseminated to investigators throughout Alberta by the Justice Department in May of 2018. So in addition to outlining procedures for undertaking and managing sexual violence investigations, the guide also included the importance of responding with a trauma-informed approach. It addresses myths and misconceptions, things like how someone should act who's been sexually assaulted, when we know response to trauma varies and there's no right way for anyone to respond to sexual violence. And it also emphasizes the importance of investigating with collaboration with victim support services. So our agencies, victim services, as well as the health center providers or health service providers. Now this map gives you a little better picture of the regions that our member agencies serve, and where the dots are where they have offices as well as satellite offices. And they do work so hard to meet the needs of people affected by sexual violence, but you can see that there are large regions of the province that don't have a coordinated and collaborative specialized response to sexual violence. So a lot of the northern parts and some central areas. And what happens then is if individuals or families require support, then they either have to travel great distances, rely on non-specialized support, or go without services at all. So last year, the government provided us with some much needed funding for regional service expansion to rural Alberta. So where they wanted to launch the collaborative community response, there's 7 areas. The Northwest around High Level, High Prairie, Peavine, Rainbow Lake. Northeast around Fort Chipewyan and Fort McKay. North Central, so Wabaska, Slave Lake, and Athabasca areas. Hinton, Jasper, and Edson. Bonnyville, Cold Lake, St. Paul, Lac La Biche areas. The Bow Valley, so Canmore, Banff, and Lake Louise. And in the Southwest, Lethbridge, Cardston, Tabor, and Pincher Creek. So funding to support the development of community response in each of those areas added much needed resources. As a result of this funding, we have a person at AASAS who's dedicated to developing services and identifying services in these regional areas. And we had 2 agencies join AASAS as members last year, the Chinook Sexual Assault Center in Lethbridge and the Harmony Project Sexual Violence Prevention and Response Program in Banff. So those are our services. And now I'm going to hand this microphone over to Lisa, and she will talk about some of our initiatives and COVID response.
Thank you so much, Cheryl. And I remembered to unmute myself before I started talking, so that's always a plus. So I will talk quickly about just a couple of our initiatives and then go into more detail regarding the COVID response from our membership. So the first initiative is our IBelieve You campaign. I'm hopeful that all of you have heard about it and have promoted it within your communities. It was launched in 2016 with the intent to have Albertans respond to survivors with a positive response of I believe you when someone discloses to them. So we have 3 of our campaign posters shown on the slide. And in recognition that anyone can be a victim of sexual assault or sexual abuse, the campaign was designed to be inclusive of gender, age, and sexual orientation. The campaign targeted the general public, as most survivors first disclose to informal supports in their lives, including friends and family members. At the conclusion of the 3-year campaign, Leger Research polled 1,000 Albertans to measure the impact of the I Believe You messaging, and it was found that the number of Albertans who now know how to positively respond to a survivor has more than tripled. And the number who would now say I believe you has increased over 12 times. So that is a significant advance in those numbers. This language and behavior change has a huge roll-on effect, as those survivors who receive that positive response when they first disclose are significantly more likely to get help, to seek justice, and be able to stop a cycle of abuse. This campaign also impacted service delivery in the province. Our AASAS member agencies saw a 53% increase in new counseling intakes in one single year. So the graph that you saw on Cheryl's slides, you would have seen quite a few spikes in it, and one of those spikes, the big spikes, was a 53% increase in those new intakes. So when someone discloses their experience of sexual violence to you, it's as easy as listen, believe, and support. That positive and supportive first response can enable healing. And we encourage Albertans to convey messages such as, I believe you, it wasn't your fault, your needs are important, and I support your decisions. So the next slide is about Alberta's One Line for sexual violence. So this is basically the most relevant information I can provide you today. The One Line was launched in May 2019, so it's not almost a year old. It's a province-wide central platform for specialized sexual violence support services. One Line is a private, toll-free talk, text, and chat platform that connects survivors, specialized, non-judgmental support, information, and referrals. Support and information is available from 9 a.m. to 9 p.m., 7 days a week, with access to language interpretation services in over 200 languages, including Cree. The line is answered by staff and volunteers from 3 AASAS member services, and they have access to a community resource guide that's basically a database powered by 211 that covers the entire province and allows them to direct the caller to the closest and most relevant referrals to their specific situation. Cheryl's going through the slides accidentally. She will go back, I'm sure. So when they are providing those referrals, if a person reaches out for assistance after hours, so beyond that 9 a.m. to 9 p.m., they are directed to our member agency in Red Deer, who also operates a talk, text, and chat service, and their service is available 24/7. So the easiest way to access that is still by calling the One Line, and you'll be referred to that other service that's 24 hours. So the One Line does help to overcome regional disparities in the province, those gaps that Cheryl talked about, by ensuring that the same access, quality of support is available wherever those users live. The One Line is able to lever the services of larger urban centers to provide that emotional support, information, and referral across the whole region and connect them to the services closest to them. And it's important to remember that responding to sexual violence trauma is a special skill that isn't shared by all professionals or paraprofessionals. Specialized support is important because sexual violence is associated with a high degree of shame and self-blame, and specialized support leads to better health and safety outcomes for those survivors. The #1 referral that the One Line gives out is to the local sexual assault service for many of those core service areas mentioned earlier in the presentation, such as counseling or police and court support. And since the start of the pandemic, Alberta's One Line for sexual violence has seen a 57% increase in the number of people reaching out for support via call, text, and chat. So now we can change slides, Cheryl. So why are we here talking about sexual violence and COVID-19? We did a study in 2019, the prevalence of child sexual abuse and sexual assault in Alberta study. It found that 45% of Albertans had experienced some type of sexual abuse, either as a child or an adult. And that means it's estimated that 1.8 million Albertans have experienced some type of sexual abuse in their lifetime. This is prior to the pandemic starting. So research conducted across the globe and during and after natural disasters and crisis events has found that there's an increased risk of domestic violence, sexual violence, and child sexual abuse for months following the end of the actual crisis. So anti-violence experts anticipate that the impacts of this global health and economic crisis will have impacts that reach far into the future. So the current pandemic of COVID-19 requires individuals to physically distance themselves from other people outside their household. That can increase feelings of anxiety or helplessness. Individuals experiencing sexual violence may also feel cut off from their support systems, both formal and informal, with public health provisions in place imposing additional barriers to accessing service and supports in the community. So in response to the current crisis, it's our hope that Albertans will be able to recognize sexual violence, respond to disclosures in a positive and supportive way, and refer survivors to specialized supports when needed. So now we'll just give a brief overview of what our member agencies are currently doing in response in 3 specific core service areas that were discussed earlier in a bit of detail: counseling, public education, and police and court support. So in regards to services, our members are still serving clients, and that's sort of the bottom line of this response. They're adjusting their services to fit the requirements required by public health directives, so physical distancing. Many of the sexual assault services have suspended in-person therapeutic individual and group counseling sessions and are converting or have converted to moving their existing counseling clients from in-person sessions to over the phone or online sessions through secure web platforms. So most agencies report that the majority of clients, somewhere in the neighborhood of 80 to 90%, have transferred over to this online format. But there are some clients who are choosing to wait for the resumption of in-person services. And there's many factors that are influencing this, including the acknowledgement that not all clients have access to appropriate technology for web-based platforms. They may not have appropriate space, or they may not even have the safety to be able to participate in online or telephone sessions from home. Many locations are finding that the current service focus for clients has shifted to the development of practical skills such as coping and containment, as well as crisis management to help them cope with increased anxiety associated with the pandemic, as well as to help them deal with practical life concerns such as job loss and food insecurity, rather than on the trauma processing that would be typical of their previous counseling sessions. As well, sexual assault services are reaching out to clients that are on their wait list. So most of our counseling programs do have a wait list for new clients that are wanting to seek counseling. So they are reaching out to those individuals on the wait list to ensure that they can offer online support and resources and assist them while they're still waiting for that counseling appointment. And in terms of some of the future considerations that our members are looking at as this current pandemic is expected to stretch and go on for an unknown length of time, they're recognizing that the complexity and overall needs of some clients has increased during this stressful time, and that has led to an exacerbation of their complex trauma symptoms. And the pandemic has also illustrated some unique research needs in the area of best practices for virtual intakes and assessments for new therapeutic counseling clients, as well as best practices for virtual trauma processing therapies and interventions. So turning to the area of public education, these programs at our member agencies are typically focused on delivering presentations, webinars, presentations, workshops, and seminars in a face-to-face capacity. And they've shifted very quickly to adapt their programming to an online context. So this includes creating videos, building online resources. These are being made available to their clients as well as the public via their websites, as well as increased engagement on various social media channels. In-person public education events, including the AASAS First Responder to Sexual Assault and Abuse trainings, have been suspended for the time being. And as well, Sexual Assault Services are still developing online volunteer training to ensure that the pool of skilled sexual violence responders is maintained in preparation for the ripple effect of the pandemic. Many sexual assault services are also reaching out to various community partners in their regions to aid in both the pandemic response, but also the general crisis response. So supporting other frontline workers as they manage compassion fatigue, anxiety, vicarious trauma, and burnout symptoms. In terms of the public education response and future considerations, it's important to look at, we've moved very quickly to a webinar-based education platforms and presentations in a matter of weeks, but there does need to be additional research and development in the area of looking at online sexual violence education to ensure best practices in that area as well. And the last area we're going to talk about in terms of current response by members is the police and court support programming. So as with other core services, these programs are still available, still serving clients. Their program staff are coordinating both with their agency and within our specialized police and court support network to share information and resources across the province. One of the primary concerns for our members has been maintaining access to clients, to whether that's forensic collection, whether that's reporting, to ensure that clients are able to access the services that they're looking for. Some changes have been implemented in those various environments, especially in regards to forensic collection in a hospital setting, and staff are monitoring those changes carefully to ensure that they can advocate for clients where necessary. As with counseling, the in-person services have been suspended, and program staff are continuing to reach out to existing clients and new clients via phone, email, text, and video conferencing to continue providing those services. And like the counseling staff, specialized police and court support staff are increasingly responding to general crisis management regarding the pandemic, including building coping and containment skills, but they are having new inquiries come in regarding the full spectrum of services, including reporting, forensic evidence collection, third option, and court preparation. Many clients are experiencing increased anxiety, crisis, and additional triggers relating to the pandemic. So that's combining with increased uncertainty regarding the status of their cases. Clients are unsure of when or if their case will proceed or resume, and whether or not they'll be in a position to be able to proceed at that time. So that's creating some additional concern for those clients as well. So what should you do if someone discloses to you that they've experienced sexual violence? Our team put together a sexual violence protocol that focuses on recognizing sexual violence, responding positively, and referring to specialized sexual violence services. This protocol was informed by the innovative and responsive work of the various sexual assault services in Alberta. So in terms of recognizing, this is important both for recognizing child sexual abuse and recognizing sexual assault in adults. So given the current public health recommendations to stay home, it's important to acknowledge that children are most likely to be sexually abused by a family member or someone the child knows and trusts. They indicated that depending on the type of abuse experienced, between 14 and 37% of Albertans were sexually abused by someone living within their home. And everyone is likely spending more time online, so children and youth may be at an increased risk for online sexual harassment and internet learning during this time as well. And in general, children and youth tend to be disconnected from external supports. So with school and extracurricular activities on hold, children and youth are likely to experience additional barriers to accessing support. Those people that they may have disclosed to in those situations are no longer available to them. So when relevant, it is important to assess for children at risk when you're speaking to those accessing services. And similar to child sexual abuse, youth and adults are also most likely to be sexually assaulted by someone that they know. 87% of police reported sexual assaults, women knew the person who sexually assaulted them. So even with social distancing measures in place, there are Albertans who continue to be at risk for experiencing sexual assault and who may also be disconnected from natural supports like friends, family members, and even co-workers. So with 1.8 million Albertans having experienced at least one incident of sexual assault in their lifetime, it's important to acknowledge that while some people may not currently be at risk for experiencing sexual violence, the mental, emotional, physical, and social impacts of historical sexual violence are long-lasting and significant. So those who experienced sexual violence years or even decades ago may still be impacted by that history. And while some may be suppressing their needs in order to cope with the crisis caused by the pandemic, others may be overwhelmed by that anxiety, and it may be exacerbating those trauma symptoms for those people who may not be expecting it to come up years or decades later. In terms of responding, despite the prevalence of sexual assault or sexual abuse, it remains one of the most underreported crimes in Canada. It's estimated that only 5% of sexual assaults are ever reported to the police. And practical experience and evidence-based research suggests that people often do not disclose sexual violence because they fear that they won't be believed or that they will be blamed for their own victimization. So these barriers not only impact reporting, but also help seeking behaviors. The normalization and minimization of sexual violence in society makes it difficult for survivors to recognize and make sense of their experience and the impacts that it's had on them. So now more than ever, survivors may also minimize their own needs for support and safety, given the challenge of meeting their basic needs, just as a result of the current pandemic. And also, many survivors do not initially access formal support services, such as a sexual assault center or health services or police reporting. Instead, they often choose to disclose first to trusted friends and family members. So it's important to be prepared to respond to disclosure of sexual violence in both a personal and a professional capacity. So when a survivor receives that positive response, they're far more likely to access support services and consider their options for reporting and seeking medical attention. So as we mentioned in the IBelieve You campaign, listen, believe, and support, and that positive and supportive first response can help enable that person's healing. And in terms of referral, individuals from anywhere in the province can access Alberta's One Line for sexual violence via talk or text at, actually you can go to the next slide now. No, sorry, it's not on the next slide, it's on this slide. It's at the bottom there. So 1-866-403-8000 or chat via AASAS.ca, or any of our member agencies have the chat platform available from their web pages as well. And again, 9 a.m. to 9 p.m., 7 days a week, with language interpretation services available. So we do want to encourage you to refer to those sexual violence, specialized sexual violence resources for anyone who's experienced sexual violence, as well as anyone who is supporting someone who has experienced sexual violence and they want more information or resources to help them.